Welcome to Review Central. This is NCLEX Reviewer number 12, featuring questions on physiological adaptation. This reviewer is intended for those who are eyeing, or are set to take, either the NCLEX-PN or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Let's begin. Question number 1. The nurse is planning to administer insulin. Which of the following is not appropriate? A. Medication administration record. B. 27 gauge, half-inch needle. C. 25 gauge, 5/8 inch needle. D. 22 gauge, 1-inch needle. The correct answer is D. Always check the medication record to verify correct patient, medication, dose, time, and route. A subcutaneous injection of a drug like insulin is administered with a 25 to 27 gauge and a 5/8 to half-inch needle. A 22 gauge needle is too large a gauge, and a 1-inch needle is too long as it will deliver the medication into the muscle rather than subcutaneously. Question number 2. Vitamin K is associated with which of the following? A. Clotting of blood. B. Hemoglobin binding. C. Cell membrane osmosis. D. Nerve function. The correct answer is A. Clotting of blood. Vitamin K plays a key role in helping the blood clot, preventing excessive bleeding. Vitamin K is necessary for the formation of prothrombin. Prothrombin is a protein made by the liver. It is one of several substances known as clotting or coagulation factors. When you get a cut or other injury that causes bleeding, your clotting factors work together to form a blood clot. Question number 3. At what level of serum calcium would one suspect a malignant cause? A. 6 mg per deciliter. B. 9 mg per deciliter. C. 11 mg per deciliter. D. 13 mg per deciliter. The correct answer is D. 13 mg per deciliter. A calcium level over 12 mg per deciliter is most likely caused by cancer. Symptomatic, severe hypercalcemia associated with malignancy portends a poor prognosis. Symptoms of hypercalcemia are nausea, polyuria, confusion, kidney stones, and weakness. Symptomatic hypercalcemia requires emergent treatment. Cancer-associated hypercalcemia occurs in about 1/3 of patients. In most cases, these patients have advanced cancer and a poor prognosis. Common malignancies associated with hypercalcemia include lung or breast cancer and multiple myeloma. Hematologic malignancies like lymphomas and leukemias also may be associated with hypercalcemia. Question number 4. What is the most common type of ventricular septal defect? A. Ostium primum defect. B. Paramembranous. C. Coronary sinus defect. D. Arteriovenous canal type. The correct answer is B. Paramembranous. Ventricular septal defect, VSD, is the second most common congenital cardiac malformation, accounting for about 1/5 of cardiac anomalies. VSD usually is diagnosed during childhood. Diagnosis of VSD is less common in adults. Typically, large defects are surgically corrected in childhood and smaller defects spontaneously close. The majority of paramembranous VSD close spontaneously by the age of 1 year. Question number 5. What is not true regarding the following of preeclampsia? A. If the infant is premature and the degree of preeclampsia is mild, then weekly non-stress testing with or without biophysical profile is recommended. B. NSDs should be done biweekly if there is any concern about oligohydramnios or fetal growth restriction, both signs of placental dysfunction. C. NSDs always should be preceded by ultrasounds and followed by CSDs. D. Laboratory study evaluation of renal function, liver enzymes, platelet counts, and urine protein levels can also aid in monitoring this disease. The correct answer is D. It is not true that NSDs should always be preceded by ultrasounds and followed by CSTs. NSDs alone instead of full BPP often suffice in following mild preeclampsia, and BPPs and or CSTs should always follow an abnormal NSD. Question number 6. Which of the following patient groups is most likely to present with carbon monoxide poisoning? A. Patients who smoke. B. A healthy young adult. C. Patients with hypertension. D. Patients who are manic. The correct answer is A. Patients who smoke. Patients who smoke have an increased risk of carbon monoxide poisoning, particularly if they smoke a large number of cigarettes in quick succession in an enclosed space or have lung disease. Carbon monoxide poisoning symptoms include headache, nausea, vomiting, dizziness, altered level of consciousness, and chest discomfort. Commonly, patients describe the symptoms as flu-like. Carbon monoxide is produced by the burning of fuel. Gas ranges, stoves, generators, motor vehicles, grills, fireplaces, and furnaces all pose a risk for toxicity. Question number 7. Which of the following nursing-specific instruments assesses the patient's risk for pressure ulcers? A. Activities of daily living, or CATS ADL index. B. Swallowing assessment scale. C. Braden scale. D. Visual analog scale. The correct answer is C. Braden scale. The Activities of Daily Living Assessment Tool, CATS ADL Index, is used to determine the dependence or independence of elderly adults. The Swallowing Assessment Scale, SSA, is a screen used for dysphagia. The Braden scale is a nursing-specific instrument that assesses the patient's risk for pressure ulcers. Other scales used for adults include the Norton and Waterlow scales. Children are assessed using the Braden Q and StarKid scale. Visual Analog Scale, VAS, is a diagnostic tool used to help patients deal with repetitive stress injury pain. Question number 8. What does the new appearance of pupillary dilatation after neurosurgery indicate? A. Raised intracranial pressure. B. Adverse effect of general anesthesia. C. Ciliary muscle dysfunction. D. Development of a new neurological disorder. The correct answer is A. Raised intracranial pressure. Cerebral edema can result from surgical manipulation of the brain following any intracranial procedure. Postoperative patients should be closely monitored for signs of raised intracranial pressure, ICP. Frequent neurological checks and assessments for pupillary size changes are important in the neurosurgical postoperative period. The ciliary muscle is involved in the accommodation reflex, not in the pupillary light reflex. Loss of pupillary reactivity is an early indicator of raised ICP. The afferent limb of the pupillary reflex is the optic nerve, and the efferent limb is the oculomotor nerve. Question number 9. A patient with a peptic ulcer undergoes endoscopy. He has been on NSAIDs for his osteoarthritis for a long time. It is decided to start him on a drug that will increase mucus and protect the gastric mucosa. What is the medication? A. Omeprazole. B. Misoprostol. C. Cimetidine. D. Aluminum hydroxide. The correct answer is B. Misoprostol. Prostaglandins in the stomach increase the production of mucus and bicarbonate and help preserve the integrity of the mucus-bicarbonate barrier. This barrier protects the gastric mucosa from the corrosive effects of acid, pepsin, and bile. Misoprostol is often prescribed together with NSAIDs. A major side effect of misoprostol is diarrhea, and women who could become pregnant should not use it. Question number 10. Which of the following signs or symptoms are not associated with diabetic ketoacidosis? A. Dehydration. B. Hypotension. C. Heightened awareness. D. Polydipsia. The correct answer is C. Heightened awareness is not associated with diabetic ketoacidosis. Patients with DKA may be agitated but usually are lethargic or even comatose. Dehydration and shock are common findings in untreated DKA. If DKA patients are not comatose, the usual symptoms such as polydipsia may be seen. You have just completed NCLEX Reviewer number 12, which featured questions on physiological adaptation. If you wish to watch more NCLEX reviewers on physiological adaptation, check out our NCLEX Physiological Adaptation Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share it to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX, and we look forward to your fulfilling career as a professional and licensed PN or RN. Good luck and God bless.